Authorities in China say the death toll from the coronavirus has now passed the 800 mark. That means the disease has now killed more people than the deadly SARS outbreak nearly 2 decades ago. Almost all the reported deaths and most of the new infections are in the Chinese province of Hubei, where the coronavirus was first discovered. Globally, there are now some 37,500 confirmed cases of the virus. China says there have been fewer new infections than in previous days, but overall the virus continues to spread. On Monday, millions of Chinese are expected to return to work after the extended Lunar New Year break is over. Nevertheless, China is still far from back to normal.
This is the extent to which China is trying to get a grip on this outbreak. Medical officials forcibly remove a family from their home. It is believed they had just returned from Wuhan and had refused to self-quarantine. A third man is determined not to go without a struggle. In the end, it takes 4 adults to drag him out. At the World Health Organization, the spread of the disease isn't their only struggle.
At WHO, we're not just battling the virus, we're also battling the trolls and conspiracy theorists that push misinformation and undermine the outbreak response.
With more than 800 fatalities, the coronavirus has killed more people than SARS, but the real number could be higher. Whistleblowers have reported doctors not diagnosing cases and disposing of bodies. Meanwhile, rescue flights continue. 30 Filipinos were flown out of Wuhan, ground zero of this virus, and landed back in the Philippines on Sunday. More than 20 countries are now affected, with almost 40,000 cases. Among them, a family of 5 living in the French Alps were infected after coming into contact with a man who'd been in Singapore.
My daughter was in the same class as the boy who has contracted the coronavirus. And what we really condemn as parents is that we haven't received any information, either from the school or from the city hall, on what we should do now.
2 local schools will be shut for the next week. Authorities here finding that, like the virus and misinformation, concerns spread quickly too.
Dr. Sterios Moskos is a molecular biologist from Northumbria University in Newcastle in the UK, and he joins me now. Sterios, hi. More people have now died from the coronavirus than from the deadly SARS outbreak nearly 20 years ago. Is that a cause for new worries?
No, it's not, and quite simply because the number of cases that we have for coronavirus by far outstrips the number of cases overall that we had for SARS. So the relative danger of the virus is much smaller. I think what we need to pay attention is the requirement for people to be informed of correct information. The virus is almost exclusively affecting China right now. There's a handful of cases around the world. That is in itself cause for attention and concern, but for public health authorities and government, it's not at the moment something that people on a day-to-day life should be concerned about. You just raised the point about a family whose child was in the same school as the one affected in the Alps. That is an example of where information needs to be conveyed quickly and efficiently to inform these individuals that if there are symptoms of flu, and there has been a potential risk of exposure to somebody who's been in the affected territories, then they need to stay at home and notify the local health authorities. And it's as simple as that.
So not a cause for mass panic yet, but the infection rate is still high. But China's saying there's been a slowdown in the numbers of people contracting the virus now. Have we reached the outbreak's peak?
No, what we are seeing is that the number of people getting affected is remaining fairly consistent. It's not accelerating. One has to, we all are going to bait our breath and see what happens over the next few days as the people return to work in China. The economy has to continue moving on. The real risk is that we have a disease where the number of severe cases is quite relatively high. And those cases place a substantial burden on healthcare providers anywhere. Even in the West, if we had these kind of numbers, we would be struggling to keep up with the cases. So that's the concern where it stands. The next concern is the availability of medical supplies to the Chinese. There's a lot of people out there, and even here in Newcastle, I've seen people wearing masks. You don't need to be wearing a mask unless you yourself are experiencing flu symptoms. And this is not my opinion, this is what the WHO recommends. People are going away hoarding masks. This is not what we need to be doing, because it's not going to offer us any protection from getting the virus. We need to be making resources available to China and other countries who are under-resourced compared to China, so that if the situation gets worse, they have the necessary supplies to cope with it.
Stelios Moskos, many thanks for that update.
You're very welcome.